everyone. My name is Emily Tippins, and I'm the research coordinator at the Sexual Behaviors Clinic, or herein referred to as the SBC, which is an outpatient clinic, part of the Integrative Forensic Program at the Royal Ottawa Mental Health Centre. Today, I'll provide an overview of our study titled Enhancing Consensual Social Skills to Prevent Non-Consensual Sexual Acts, a randomized control trial on individuals with problematic sexual interests in children. The execution of this study would not be possible without the funding support from the Innovation Fund Provincial Oversight Committee. Historically, criminal sexual offenses and other problematic sexual behaviors have been a major public safety concern. Research has shown that childhood sexual abuse is associated with long-term negative outcomes, such as psychosocial problems, alcohol abuse, self-harm behaviors, and other psychiatric disorders. Despite these negative impacts, limited research has been conducted on group-based methods to treat and prevent those with pedophilic interests. To date, most treatments for men with pedophilic interests have involved attempts to suppress all sexual interests or to only encourage them not to act on their pedophilic interests. Acceptance of the hypothesis that men with pedophilic interests cannot change their sexual interests towards age-appropriate adult interests has led to nihilistic opinions concerning the treatment of men with pedophilia. Building on evidence that sexual interests, which is separate from sexual orientation, can potentially be changed, we are currently examining the efficacy of group psychotherapy to treat those with sexual interests in children by determining whether there is a possibility to reduce sexual interest in children through promoting appropriate social skills and healthy consensual adult sexual relations. Our study will include 60 adult male participants who have been assessed for a question of sexual interest in children at the SBC and who have not previously participated in group psychotherapy. Patients are first assessed by a psychiatrist and are then deemed eligible to participate in the study. Following this, the patients are provided with informed consent and are then randomized into either the intervention group, focused on enhancing social skills, or into the control group, which is focused on cognitive distortions surrounding sexual interest in children. Both groups take place once a week for an hour and a half and are open-ended, meaning that participants can begin attending group at any time. For the purposes of this study, we ask participants to attend 12 sessions. The groups are facilitated by a trained social worker and psychiatrist. The social skills group follows the methods of cognitive behavioral therapy and the philosophy of the Good Lives model. Each social skills group begins with a check-in with the group members, which provides them a chance to practice their social skills by conversing with the group. The group discussion is then centered around a topic focused on improving social skills. The theory, design, and methods of these groups are currently being manualized. The control group on adult interests is primarily focused on CBT methods. In order to test the differences in sexual interests, sexual consent, and social skills, a number of questionnaires are provided both pre- and post-intervention. One of our main outcome measures is also an objective measure of sexual arousal called penile plethysmography testing, or PPG. The PPG examination consists of measuring physiological arousal while the subjects are presented with audio and visual stimuli. A depiction of the testing can be found on the right side of the poster. In addition to the objective and subjective measures, this study also consists of a qualitative component where 10 randomly selected participants who have a partner, friend, or family member who are aware of their sexual interests and that they are currently in treatment participate in a 1-hour-long semi-structured interview to discuss their experience in group and any changes that they may have noticed in their sexual interests or social skills. Both the participant and their study partner are interviewed separately. We have currently recruited a quarter of the desired sample size, and data from participants who have completed the study show increased sexual arousal to adult consensual sexual relations and a decrease in sexual arousal to children. Qualitative data from the interviews demonstrate improvement in coping methods to control sexual urges, as well as improvements in cognitive distortions surrounding children. Study partners have also expressed that the social skills group psychotherapy has been very beneficial for their partner in many ways. Next steps include completing the recruitment and testing to obtain the desired sample size, which is planned to be completed in the coming year. Then we will analyze the data and translate the findings in the hopes of reaching clinicians, as this study will provide evidence for how best to treat those with sexual interests in children. Do not hesitate to reach out to me via email if you have any questions, and thank you so much for listening.